Hello, my name is Adrian Richards. I'm a plastic surgeon and I'm the clinical director of Aurora Clinics, which is a plastic surgical company with a number of plastic surgeons who specialise in different fields in the southern part of the United Kingdom. Now, in this video I'm going to be talking a little bit about the labia majora and the treatments that can be used to treat this area. In other videos I've talked about treatments for the labia minora, but in this one I'm going to focus on the labia majora. Just be absolutely clear on what the labia majora are. These are the outer vaginal lips, the hair-bearing skin lips, which are the most visible areas externally. Now, these can cause problems for people, particularly if you've lost a lot of weight. Some people feel the area is just a little bit heavy, the skin's a little bit loose in the region, and there's a number of techniques that can be used to make the labia majora slightly smaller and also to reduce the skin excess in the region. Now, the majority of the techniques either involve liposuction or removal of the skin itself. Liposuction is suitable if the labia majora are slightly too full. So if you feel your labia majora are slightly too plump and too firm and cause contour irregularity, so if they're visible through clothing, if they're a bit prominent in the area, it's relatively simple to perform liposuction on the area, which is going to remove some of the fatty tissue within the labia majora and make it less plump and less obvious. And that's a very successful treatment, which only involves very small little incisions and will be pretty indetectable, and also has a quick recovery period. Excision of excess skin is slightly more involved, and normally it involves a removal of the skin from the inner part of the labia majora. The scar is normally very well healed and a natural skin crease, and if you feel that you have got excess skin in the region, and a small tightening up of skin in that region with a concealed scar and using absorbable sutures can be really effective at tightening up that area. And of course, both techniques, the excision of the skin combined with the liposuction, can be used together, and often a treatment in conjunction with a liposuction used to reduce the fatty element, and the skin excision to remove or reduce the skin element is in many cases the best combination of treatment. So if you do feel that you may be considering labia majora reduction, it's very important that you do see a surgeon who specialises in this type of treatment, and we do have a number of these here at Aurora Clinics, and we'd be delighted to schedule you a consultation with one of our specialists if you thought it appropriate. Alternatively, if you send us an email, we'd be happy to email you a reply to any queries. If you wanted to come in for a consultation, all our consultations are free of charge, and we'd be happy to schedule one at a convenient time for you so that we can discuss the best options for you, discuss the pros and cons and the likely results of surgery. So thank you very much for watching the video. I hope you found it useful and informative. Please have a look around other areas of information about this type of surgery, and we do look forward to seeing you if you do decide to schedule a consultation.